Elsevier, we're doing the third edition of Arthritis in Black and White. It's a classic text, but hasn't been revised in 12 years, and so it's time.
Oh, wow. Excellent. How long have you been working on that?
Too long, if you're asking Rebecca. So, but no, it's been for this past year for the revision. The book was a unique book when it was first published, and it still is, and that it works more like how the trainee works in terms of they have an opportunity to look at a hand and look at the abnormality and try to sort out what it might be in one chapter, and then go, if you think it's rheumatoid arthritis, go back to another chapter in the back of the book and find out if by reading more in depth about rheumatoid arthritis, whether it actually is that diagnosis. So revising it, it's a beautifully written text. It met a lot of important needs, but there's been advances in radiology in terms of use of CT and ultrasound and MRI. And we wanted to keep the flavor of emphasis of plain film radiography, and we incorporated a lot more advanced imaging to help the reader understand why the images look like the way they do on plain film.
How does that work?
Well, it's very positive. Sort of joking about Rebecca. She's been very, very positive, and it's been a very upbeat experience. Yes, Dr. Brower brought me in on the book soon after I finished my fellowship training, and that was her way of mentoring somebody and bringing them into the field, and likewise Dr. Brower allowed me to bring in one of my former residents, and is currently a colleague, and Stephanie Bernard, into the project, and so Stephanie has been a key component of putting this third edition together. Yeah, I think that the biggest thing right now is trying to find a place for books in education, because of the generation that's coming up is very much online, and but there's still a need for books, and they still like to use books. But the books and how they were used when I was in training are considerably different, and there's obviously a big push in Elsevier as part of this, getting into the case series and case discussions. And,
the case reviews.
Reviews, and that's a very positive thing for allowing a learner to be able to test their knowledge, but still getting that good basic textbooks that allow for foundational learning are still necessary, and it allows the trainee to get a broader sense of the scope of the subject that they're looking at. One of the downsides of online learning is that if you type in osteosarcoma, then you're going to get osteosarcoma and nothing around it, and so there are some disadvantages to relying just on online sources.
Sure, absolutely. So once you complete this, are there further books in your future?
Oh, I don't know. Yeah, no, that's an interesting question. There might be, but it is a tremendous amount of work. It's rewarding, but it is a tremendous amount of work, and then you have to fit that in with what your other life goals are, and try to maximize whatever time you have. So I'm getting older, and I've got only actually relatively. It's amazing how fast it goes, and I have a relatively small amount of time left to be reasonably productive, and so I have to sort of manage that well to make sure whatever reasonable time I've got left in the industry is going to be put to a good use.
Rebecca's going to see this. She's going to be all over you now.
As she should be. No, it's very, very positive. She let me put it this way, she'll appreciate this, she made sure I was on task. That's right.
All right, very good. That's all we need.
There you go.